Hello friends, let us now learn the important points about stridor. So stridor, first we will see causes of the stridor. So in the causes of the stridor, first we will see all the laryngeal causes, then we will see all the non-extra laryngeal causes. First in the laryngeal causes, first we have congenital. So congenital includes mainly infantile larynx, it includes laryngeal web or stenosis, then it includes congenital hemangioma or cyst. It includes congenital hemangioma or cyst, and it includes laryngomalacia. So here you have infantile larynx, laryngeal web or stenosis, congenital hemangioma or cyst, and laryngomalacia. So these are the congenital causes of stridor. Next, if you see, you have inflammatory causes of stridor. In the inflammatory causes of stridor, we have acute laryngitis is seen, and you have diphtheria is seen, and then there is allergic edema is seen in the acute laryngitis of okay. In stridor can be caused by acute laryngitis, diphtheria, allergic edema, laryngotracheobronchitis or croup. These are the inflammatory causes of larynx, inflammatory causes of stridor. Then we have traumatic causes. So if you see the traumatic causes, it can be either birth trauma or it can be due to burns or scalds or accidents. So all these will result in stridor. Then it can also be caused by neoplasms. So if you see the neoplasms, like we have papillomas, cysts, and then tumors will cause laryngeal stridor. Then laryngeal stridor is also caused by foreign bodies, and it is also caused by neurological disorders also. It is also caused by neurological disorders. Like neurological disorders include, it is caused by vocal cord palsy, and tetanus can also cause laryngeal causes. So these are the laryngeal causes of stridor. What are they? First we have congenital causes like infantile larynx, laryngeal web and stenosis, congenital hemangioma and cyst, and then laryngomalacia. Then we have inflammatory causes. Inflammatory causes include acute laryngitis, diphtheria, allergic edema, laryngotracheobronchitis. Then we have traumatic causes, which include birth trauma, burns and scalds, accidental accidents. Then we have neoplasms, which include papillomas, cysts and tumors. Then we have foreign bodies and also neurological disorders and vocal cord palsy. These are laryngeal causes. Then next we have extra laryngeal causes. So in the extra laryngeal causes, in this you are going to see, one, you have congenital extra laryngeal causes. One of the congenital extra laryngeal causes is Pierre-Robin syndrome. We have Pierre-Robin syndrome and also vascular loop are the congenital extra laryngeal causes. Pierre-Robin syndrome and vascular loop. Then we have neoplasms can cause it, tumors, or it can be due to traumatic or foreign body or inflammatory causes. So all these are the causes of stridor in children. Congenital causes like Pierre-Robin syndrome, vascular loop, neoplasms, traumatic, foreign body and inflammatory are seen. Next, what are the causes of stridor in adults? If you see the causes of stridor in adults, one, we have infective causes of stridor in adults, which include the edema of larynx is seen, and there is also epiglottitis is seen. And in the traumatic causes, definitely it will be there, and there will be allergic causes of stridor and neoplastic causes, and also tetany will also cause stridor in adults. Like we have seen lots of causes of stridor till now. But the question is, among all these, if you were asked what is the most common in children, most common in children is, first, most common cause of chronic stridor in children. Chronic stridor in children, most common is laryngomalacia is the most common cause of stridor in children. And if you were asked what is the most common cause of acute stridor in children, upper respiratory tract infections. If you were asked about the most common cause of chronic stridor, but this is actually in adults. Most common cause of chronic stridor in adults is actually laryngeal carcinoma. So what is the most common cause of chronic stridor in children? Laryngomalacia. Most common cause of acute stridor in children, upper respiratory tract infections. Most common cause of chronic stridor in adults, laryngeal carcinoma. Next. Thank you.